This is Dr.RUkmani and you're watching Everyday Health Result. My today's topic is dermatomyositis. That means there is an inflammation in your muscles and your skin. Though this is a rare condition, but yes, this is seen. This is very similar to autoimmune disorder, though it is not classified among autoimmune disorder, but the symptoms, they are very similar to lupus, similar to autoimmune disorders. And what are autoimmune disorder? These are the immune problem in which your body mistakenly attack its own cell and damages and destroy them. So these are like autoimmune disorder. Now, what are the causes and what are the risk factors for dermatomyositis? Derma means skin, myositis means muscles inflammation. So this is a condition in which you have muscles inflammation, skin rash, joint pain. We'll discuss later on in symptom part. So risk factors are women, female, they are more prone to have this problem. Age factor, kids 5 to 15, they have more this problem. In adult, 40 to 60 years is the age bracket in adult. So these are the risk factors. Now what are the causes behind why you have this problem? There is no certain or exact cause, but there are certain like believed or researchers believes or scientific believe that these are the after some studies that these are the risk factors that can cause or these are possible causes. These are genetic history. If this run in family, sometimes it is believed that this is a genetical problem. Environmental factors, if you reside in environment where there is a high pollutions or there is poor air quality, so you might get this kind of problem. Viral infection, you are recovered from a viral infection, but even after that you can get this problem. So these are the certain risk factors. Viral infection, environmental factor, autoimmune. Though these are not classified, but their symptoms are very similar, so it is considered a sign or symptom of dermatomyositis. Dermatomyositis, see, sometimes it takes years or weeks, months or years to develop its symptom, and sometimes the symptom comes all of a sudden and symptom goes and comes. So they are flare-ups of this disease. Sometimes you feel better and sometimes there is aggravation in your symptom. So it's like that. The peculiar symptom are these are muscles inflammation. Myositis means muscle inflammation, and dermato, there is a inflammation of your skin as well, and you have a rash on your cheeks, on your surrounding your eyes, or sometimes on your chest, on your shoulders. So this is called V sign. And sometimes you have rash on your neck, on your back of your shoulder. So this is called shawl sign. So these are particular sign for dermatomyositis. And you have see, this is like muscular problem. You are having your muscles are weak, they are damaged, there is atrophy. So movement are affected, and movements like you are not able to getting up from the chair, you are not able to move, you have joint pain. Sometimes there is a speech problem and you have problem in swallowing, difficult swallowing. You have dysphagia due to muscles problem. Your muscles are your throat muscles, your neck muscles, they are very weak. Due to that you have dysphagia, difficult swallowing, difficult in speech. So these symptoms can be there. Sometimes you have there are rash on your knuckles, joint pain obviously you have. So what are the diagnostic criteria? How we confirm that you are having dermatomyositis? See, there are certain blood tests. Your antibodies are checked through blood tests, and sometimes there is a your imaging test. MRI is done for a particular organ. If to ruling out a problem in internal body parts, and sometimes your chest X-ray is done to rule out again the chest inflammation, lung inflammation, and EMG. Sometimes it is done EMG electromyographical. Your muscles or nerve conduction study is done. So checking out your muscle strength, or biopsy is done. Certain these are tissue sample is taken from the affected muscles, and that is studied. So these are joint biopsies, skin biopsies, and muscles biopsy for affected parts, and is studied further. And your skin is discolored. Sometimes it is like purplish, violet, and your skin is discolored, or you have particular rash. Certain diagnostic criteria. Now what are the treatment approach and management? So treatment in allopathy, as this is an inflammatory problem, so steroids are given. Steroids, and particularly corticosteroid. These are the medicine that reduces your swelling. These are anti-inflammatory type of medicine, so reduces your swelling. Now most important thing is that the physiotherapy, you are supposed to do certain physical activity. You can start with the mild or moderate one. Huh. So for muscles and bone, it's like that. If you work for them, they are stronger. Huh? You provide a strength to them. So just be physically active for your muscles and bone. So you don't, if you make your muscles strong, so if they are, damaged or weak, so they can compensate the loss. Huh? So just be physically active and go for a routine, your physical therapies. EIG, immunoglobulins are given. It depends what is the severity of the case. Treatment is planned accordingly. Now the best effective homeopathy medicine in dermatomyositis. See, it's not that unlike allopathy, it's like individual approach, collecting your symptom, going into back, like you checking your past medical history. It's like complete, making complete list of your symptom, present, past, or whether it's in your family or not, and a holistic approach, collecting all your symptoms from head to toe, your likes and cravings, each and everything. So it's like constitutional approach. So there are a couple of medicine, but these are not the general one. There can be different medicine for the different individual. I'm discussing some of the medicine. These are Bryonia, Arnica, Plumbamed, Kalika, Kilkiriaka, Arsenicum album, Rustox, Arnica, Gelsemium. These are the medicine that works on your skin as well as on your muscles, to give them strength, to give them support. Arnica montana. Arnica montana, you must have heard about muscles injury, or the skin injury. So this is perfect medicine for skin and muscles. If you have contusions, your skin is discolored and you have pain, muscles pain, so this reduces even the swelling, this reduces inflammation, and this gives you strength to your muscles. So arnica, this is in the liquid form, 30 or 200. With the help of dropper, you can take 1 or 2 drops 1 or 2 times. If you belong to different country, you might get different form, but just go with the main medicine name, Arnica montana. You can even apply cream on affected part. If you're watching on YouTube, you may find all medicines link below in description box. With Arsenicum album. Arsenicum album, a very good remedy in homeopathy for skin and muscles as well. Arsenicum has again, if you have more of your symptoms are mental, like you are having there is anxiety, there is restlessness, and your problem is aggravated in night, so night aggravation is there. And if you have even cough problem and a respiratory problem as well, so you can start with Arsenicum album. This is in the liquid form again, 30 or 200 strength. With the help of dropper, 1 or 2 drops 1 or 2 times. Use it regular. Causticum is again very effective. Causticum particularly works for throat or neck problem. So if you have problem while speaking, means you have a speech problem, or you have dysphagia, problem in swallowing, so in that case you can start with causticum. 30 or 200, 1 or 2 drops 1 or 2 times, till the time you start seeing difference. Kalikap is a constitutional remedy. So Kalikap works in joint pain. There is a digestion problem, muscle stiffness. So you can start with Kalikap. See, this is a different company, so different color. Again, with the help of dropper, 1 or 2 drops 1 or 2 times. Use it regular. Calcarea carb again has sensitivity towards cold, and Calcarea carb is again a constitutional remedy. Calcarea carb has again the problem of muscles. You have muscles pain, you have joint pain. So these are the symptoms of Calcarea carb. Again, but this is the top remedy, Rustox. Rustox work amazing in your muscle stiffness, your muscle inflammation, joint problem, joint pain. So these are the key indication of Rustox. You can start with Rustox. Again, with the help of dropper in the ointment form. So you can apply on the affected part, on the joint, affected joint, Rustox. Start your treatment. If you're watching on YouTube, for video or individual video or voice consultation, you can drop your message on WhatsApp number for individual video or voice consultation. Thank you so much. Thank you.